Welcome, everyone. I'm Adesewa Josh, and this is Africa Matters. The coup attempt in Sudan this week suggests that military takeovers in the continent could be far from over. We'll find out what's behind the return of coups and why many seem to be celebrating the changing of the guard. We'll also go to Nigeria, where a COVID-19 handbook in one of the local languages is helping children understand and cope with the pandemic.
She'll come, she'll show me the child from far. This is what you do to them for. And it's really, you have to fight.
And later we'll hear how a man in South Africa survived COVID-19 because a local NGO gave him a chance to breathe again. The Northeast African country of Sudan is no stranger to military coups. It has had at least 16 coup attempts since independence in 1956. 5 of them have been successful, and the latest attempt was on Tuesday. Authorities blame loyalists of ousted President Omar al-Bashir, who was forced out of office by a popular uprising 2 years ago. But you see, Sudan isn't alone. In just over a year, Africa has experienced 3 successful coups, 2 in Mali and 1 in Guinea. There have also been 2 failed coup attempts in Niger before the more recent one in Sudan. And Chad saw a military takeover after the death of President Idris Deby. So, does Africa have a coup culture? And why is it making a comeback? Are these military coups even about the people? Let's explore this further with Dr. Ndubisi Ani. He's a security analyst. Thank you so much for joining us. Are Africans more tolerant of military coups compared to the rest of the world?
I wouldn't say that. It is not that Africans are tolerant about coup. Africans are well aware about the dangers of having coup and having military officers rule regimes. But then the problem is about what is the last option that is available to civilians and to ordinary people. Come to look at it, in the West, for instance, you have a working judiciary, you have a working systems where citizens can easily change the trajectory of their life through elections and through advocacy and the likes. But then in Africa, you find a situation where the ruling elites are manipulating elections, are manipulating constitutional review processes to suit their needs. So it becomes available that a coup or military coup ends up being the avenue where leaders can remove people from power. For instance, when you look at all the coups that happened, or even the popular uprisings that happened, the 7 popular uprisings that happened in Africa, you see that the action or the inaction of the military is very significant to the success of a change in government. So one has to look at that in context, that it's not about preference for military coup, it's about the options available.
So what do we then say about the recent coups in Guinea and Mali? It began with protests by ordinary people, but it seems they got hijacked by the military. Are they seen as a better alternative to democratically elected leaders, and why?
Yeah, so I wouldn't say that they are seen as a better alternative. When you look at actually the coups and the military coups and the aftermath on the African continent, you see that the military regime have even been worse than the regime that were ousted. So when you look at Omar al-Bashir, for instance, he came following military coup incidences in the region, and then you see him coming to power, and then it's a matter of it became worse than the regime that is there. When you look at the current transitional government in Sudan, the situation is not good in the country. And what happened right now is that the failed coup that happened just recently is about trying to take away the transitional government that is in place. And that was after the military coup, and people thought that there will be safe havens. And then when you look at Libya, for instance, after the rebel uprising and then popular uprising that took out Gaddafi, the country became worse. So it's not about the fairness, it's not about the goodness that comes from coup, but people prefer that let there be radical change rather than a fake democracy that people have and then think that, okay, there's a democracy, freedoms and human rights, but then nothing is been happening in terms of progress for civilians.
The African Union has outlawed coups. They've suspended several countries and threatened sanctions, but that hasn't prevented more coups from happening. How can the EU and regional bodies deter coups effectively?
You're very right. I think that question is very significant in the sense that the African Union and ECOWAS have protocols and the African Charter which outlaws coups specifically. But then you cannot outlaw coup and then still have the conditions that generate coup and mass grievances. So let's talk about constitutional coups and electoral coups. Those are the most insidious kind of coups that have enabled the occurrences of about the military overt coups on the continent. So when we look at it, the African Union, for instance, says that any constitutional amendment to prevent democratic change is unconstitutional change in government. But this happened in Guinea, for instance, but the government, the African Union and ECOWAS did not go into Guinea to say, okay, to say to Alpha Conde, why did you change the constitution to put a clause that will let you be in power? So those kind of, let's say, two-faced kind of responses to coups do not give confidence to the ordinary citizens. So the African Union has to ensure that constitutional coups and electoral coups are kind of banned, and there's no way that that happens, and the leaders stay maximum up to their terms. But it's very important to note that staying more than your term is not the actual problem. Staying more than, if you look at Germany, for instance, Angela Merkel have been there for a long term and she has not, and she's ruled accordingly. The problem is about the democratic processes, having strong institutions that work, having constitutions that speak to the interests of the citizens rather than constitutions that are made to address the condition or situation of individuals. So that is where the problem is. And the African Union has to thwart those processes and stop backing their member states or member countries who change constitutions against the will of the people.
African leaders were among the more than 100 heads of state meeting at the UN General Assembly in New York this week. They are pushing for vaccine equity as 96% of the continent's population has yet to be vaccinated. Richer countries have stockpiled doses, and some are already giving out third shots. African leaders also want more funding to tackle the climate crisis and terrorism.
Africa refuses to serve as a rare base for international terrorism. This is why some African leaders, such as those of the G5 Sahel, have organized themselves to pool their forces against this common enemy.
And we have more stories coming up here on Africa Matters.
Every day, about 15 women die in Uganda during pregnancy and childbirth. I am Darren Allan Kyeyune at a hospital in western Uganda, which is trying to change that.
I am Poloum David in Abuja, and I'll be finding out if having a booklet on COVID-19 in their local dialect is making a difference in educating children about the virus.
The cost of healthcare can be a matter of life and death in some parts of the continent. But a hospital in western Uganda is trying to ease the burden that pregnant women face during childbirth or from complications during pregnancy. It's running a low-cost mother's waiting home where soon-to-be mothers can welcome their babies safely. Darren Allan Kyeyune reports from Uganda.
In about 2 weeks, Peace Chokutamba will welcome twins. She is a mother of 4 and lives 15 kilometers away from the hospital. But for the last 17 days, this has been her home.
I chose a C-section when I reached 8 months because I felt heavier and had pains. I'm expecting twins and it's overwhelming, so I came to the hospital to get help. I've had a lot of assistance. The babies are fine, and I'm also fine.
This mother's non-profit waiting home at Kisizi Hospital is a game changer for prenatal care in this area. It is a hilly place, and reaching the hospital in time is a challenge for many pregnant women. But once they arrive, this 24-bed unit accommodates expectant mothers who lack other medical support.
We usually have mothers who are high risks, so they have to be in hospital. For example, they have previous cesarean section scars. They have their past obstetric history is not good. Maybe she has carried like 9 pregnancies but no live child. We have incidences like there are these mothers who usually bleed before delivering, so they have to be near the hospital.
This place is a haven for many mothers and their babies. During their stay, a pregnant woman is seen daily by a midwife and checked by a specialist once a week, all for a relatively low monthly cost of $2.83. Uganda's Bureau of Statistics say about 336 of 100,000 women die while giving birth each year. This mother's waiting home has helped more than 2,000 mothers in the past 7 years, and its impact has been greater in the aftermath of the coronavirus pandemic, when many people stayed away from hospitals.
To our surprise, even when other hospital patients reduced in number, mothers in the mother waiting home increased in number. Why? Because of the transport restrictions, they thought it safe to be in the hospital all the time. But also, they didn't have fears about transmission, because they have this feeling that it's outside the hospital, and so they are not exactly patients, and they don't overly interact with the rest of the patients.
The facility is now so popular, it is often overflowing. But the hospital management plans to expand it, and midwives are happy to continue saving more lives. Darren Allan Kyeyune, TRT World, Rukunjiri, Western Uganda.
We now take you to South Africa, where charities are filling in the gaps in the healthcare system, which has been stretched by the pandemic. At the peak of the 3rd wave in Gauteng province, doctors were having to choose who lived and who died because of a shortage of beds and oxygen. But now, a humanitarian organization has stepped in to provide life-saving machines to people for free. They've also partnered with doctors in one area of Johannesburg to run a night clinic, as Ntshepeng Motema reports from South Africa.
Volunteers at the Rosi Azam Welfare Foundation thoroughly clean every machine before they lend them out again. The charity provides these life-saving oxygen pumps to COVID-19 patients around South Africa at no cost.
When people started sharing their success stories of winning the battle against COVID, that's when our organization really got well known at a national level. And then we started receiving phone calls from Cape Town, started receiving phone calls from Durban.
Through donations, the non-profit organization is able to loan out these oxygen pumps to people with severe breathing problems. Each of these machines costs around $700, much more than most South Africans can afford. Safraz Khan is one of the recipients of the oxygen pumps. Khan recently became a father after trying for 7 years and thought life couldn't get any better. But then he became severely ill with COVID-19 and nearly lost his life. At his lowest, he says it was his wife and newborn baby that gave him strength to hold on.
Certain times where you just sit there and you cry because you can't do it anymore. And without their support, she'll come, she'll show me the child from far. This is what you need to do for. It's really, you have to fight.
As an asthmatic, Khan's doctor thought he was better off receiving treatment at home and was able to connect him to the charity providing free oxygen machines. Even though Khan is one of the 16% of South Africans who have private health insurance, his physician worried that he may not get the treatment he needed, even at private hospitals, facilities which were also being overwhelmed. During the peak of the 3rd wave, patients faced pressures on how long they could be kept on an oxygen machine before the next one had to have it. To alleviate some of the pressures on the healthcare system, a group of doctors has come together to offer a range of medical services to their community. Each day when they finish work, they come here and operate this clinic free of charge, often seeing patients late into the night. Those they are helping are people who are unable to pay for private health care.
So basically, we are doing primary health care, but we see tertiary, we see the medical emergencies, we see COVID patients, we see all sorts of patients.
Knowing the devastation that the pandemic can cause, these doctors and their colleagues providing oxygen machines to communities say they are prepared for a fourth wave and will do all they can to minimize the impact for those in need. Ntshepeng Motema, TRT World, Johannesburg.
And it's not just NGOs that are offering innovative ways to fight COVID-19. A Nigerian author has written a book in one of the country's local languages to help children understand the virus. A lack of awareness and understanding of the pandemic is one of the major reasons why the virus keeps spreading. But as Poloum David reports, this handbook could help keep children safe.
Raquel Kashim Daniel and her friend pay a visit to a local nomadic community in Nigeria's capital, Abuja. Raquel is the CEO of the Beyond the Classroom Foundation, an NGO that's committed to improving education for children. She's here to teach children about COVID-19. She's brought face masks, sanitizers, and plenty of copies of her book, which is called There is a New Virus in Town. She plans to hand them out to the kids free of charge.
When I got to the camp, my team, to give out food supplies to the families and also give the children writing supplies, the kids were wondering what we were all wearing. So they were pointing at me and asking in Hausa what it was we were wearing. So I said it was a face mask. And they were like, oh, they've been seeing it, but we didn't know what it was about. And so we've distributed 13,500 copies of the book free to children, funded by friends on social media and other partners.
Most of the children here don't understand English, so copies of the book in Hausa, their local dialects, are also made available.
I now understand what COVID-19 really is. I'll be mindful of the people I mingle with. I'll always wear my face mask and wash my hands regularly so that I won't be infected with the virus.
This COVID-19 awareness book is written in a captivating, colorful and catchy way. But it doesn't only appeal to children, their parents are also drawn to it. They say reading the book in their local dialect has helped them understand what the pandemic is really about. Haruna Yunusa has 3 children and says the book has also been beneficial to him.
The book has really educated me. I didn't know COVID-19 spread through saliva or respiratory droplets between people in close contact. It's surprising that they affected every part of the world. I and my family will now be more careful to avoid contracting the virus.
More than 200,000 cases of COVID-19 have been confirmed in Nigeria since the pandemic began. Before Raquel visited, there was little or no information available about the virus here in Agwamberi. With many similar communities across the country, every effort and awareness by individuals, corporations and the government is needed to bring COVID-19 under control. Poloum David, TRT World, Abuja.
And now for a roundup of what's making news across the continent. At least 400 people protested outside Namibia's parliament this week against the deal reached between their government and Germany. In May, Germany said it had committed genocide in colonial-era Namibia against the Herero and Nama people from 1904 to 1908. It promised $1.3 billion in financial support to descendants of the victims. Activists have rejected the offer as insufficient. The Central African Republic has welcomed 120 Tunisian soldiers to boost a UN peacekeeping force. The deployment of the helicopter unit is part of a UN Security Council resolution in March to beef up the peacekeepers' numbers by around 3,000. It's the first time a Tunisian contingent has been deployed in the country. And Somalis enjoyed a night out at the movies for the first time in 3 decades this week. 2 local films were shown at the National Theatre of Somalia in Mogadishu. It was closed by civil war in 1991, targeted by suicide bombers and used as a base by warlords. But now it's hoping to contribute to a cultural revival in Somalia. And Samuel Eto'o says he will run for president of the Cameroon Football Federation. The man, considered one of the greatest African players of all time, announced his bid as his country prepares to host the Africa Cup of Nations in January. The post became vacant when Seydou Mbobo Njoya's tenure was cancelled by the Court of Arbitration for Sport. The Tool retired from the pitch 2 years ago, but he says his passion for the game has driven him back. We stop next in Rwanda, where conservationist and veterinarian Olivier Nsengimana is on a mission to save the grey-crowned crane. These majestic birds have been on the decline in Rwanda over the past 10 years because of poaching and the loss of their habitats.
So 6 years ago, there were more cranes in captivity, in people's house, in hotels, than they were in the wild. And what was happening is like, many people really love cranes, but some people, they wanted to have them in their gardens. So there was a huge demand for illegal pet trade. So local communities, driven by lack of awareness, poverty, they were hunting or capturing them and selling them to the dealers. And people really enjoy their dance, their call. It's just one species that means a lot in the society, in the culture. In their home range, not only in Rwanda, we've lost about 80% of the whole population in the last 5 decades. So that has meant the cranes have been like a really, like in 2012, they were uplisted from vulnerable to endangered on the IUCN Red List of endangered species. So, and the population status is still highlighted as declining. So cranes are really endangered, and that's mainly because of pet trade, as I mentioned, but also another big threat or factor that is causing their decline is habitat loss. It's about really bringing as many hands, as many people as possible on board to really fight and work for the same cause. And really this one has been paying off with our efforts, like with the conservation champions, marsh rangers, and then the other awareness, all these activities we've been doing. It has contributed to the increase of grey-crowned cranes in Rwanda.
And finally, we hear from Mumbi Macharia, a poet in Nairobi. She talks about the inequities facing young people, like her, as she calls on world leaders to keep their promises to protect vulnerable women.
Allow me to introduce myself. I am the girls in the pictures you commission of abject poverty. I know it sounds poetic, but I assure you, our lives are not an aesthetic. Perhaps you didn't know that I am the girl staying home from school because I don't have pads. My future, they took that. I am the girl walking to school with a stomach heavier than my book bag. This is my life. I am no different from the girl you heard about being sold off at 12 as a wife. I am not a charity case, but that's the picture you get. I see I am my grandmother's legacy. I come from a long line of matriarchal forces, rainmakers, healers, warriors especially. My mother and grandmother now say they hope I forgive them for bringing me into a world where my very existence is a transgression, where demanding change is mundane and violence against my sisters is just another Monday. This is to you, our world leaders, the ones who have our trust, a less than few. You made all these promises you said you'd pursue, so why does the mortality rate and gender-based violence still have the longest queue? Strange. So this is to let you know that if you want to buy my vote, I don't want notes. I just want change. Love is a verb. So I don't just want you to talk about it, I need you to be about it in every sector: health, economy, climate, community. This is your opportunity in every room to put my sisters first, even the ones still in the womb. We've come a long way. So I pray that the strides we made before the pandemic are not receding. We are pleading. Do not leave us behind. We have options but no choices, opinions but no voices. It's time, it's been time to rise, refocus, recover.
That's our show this week. Please let me know what you think about the stories you've seen on the program. Share your thoughts and suggestions on what you want us to cover on Twitter using #AfricaMatters. Or you can also reach out to me on my personal handle. It's Adesewa Josh. We'll leave you with these beautiful pictures from our beautiful continent. I'll see you next time.